Now, the World Health Organization has declared an Ebola outbreak in the Democratic Republic of the Congo a public health emergency of international concern. Nearly 90 deaths have been recorded so far, and medical experts say that the current strain of the virus has a particularly high mortality rate. Well, the country's health minister said that there is currently no vaccine or specific treatment available. Dr. Samuel Roger Kamba says many of those who died didn't seek professional medical care and instead sought help from places of worship. Almost 2,300 people died in Congo between 2018 and 2020, and WHO says this current outbreak does not meet the criteria of a pandemic. Well, we can speak to BBC Africa's correspondent Thomas Mukwana now, who joins us from Nairobi. Thomas, good to have you with us. Talk to us firstly about what we're seeing in terms of spread, the risk of further spread, because of course in some remote areas you have informal borders perhaps where people cross almost daily.
Yeah, that's correct. And this is particularly troubling because the eastern DRC province of Ituri, where both the three towns that have these high infection rates come from, that region is really, really close to the border with South Sudan and Uganda. And as you know, DRC is a very resource-rich country, which means a lot of mining happens mostly in the eastern side of the country where this outbreak has happened. So a lot of mining activities, which would then translate to a lot of trade and cross-border mining activities and people trading and people trying to get to even places like Nairobi would sometimes informally cross those borders before getting to Kampala and traveling over here. The worst thing about this is that as the WHO has now just declared this an emergency of international concern, is that 2 cases have been reported in Kampala over the past 2 days. One being someone who passed on after contracting the virus in DR Congo and traveling all the way to Kampala, Uganda, before passing away in a hospital. His body has apparently been, according to reports, transported back to DRC. But even that body, as it is a dead man, could transmit the virus to whoever touches it. And this is a whole other level of virality that I think the WHO and the Africa CDC are concerned about.
So, Thomas, when it comes to infection control, are there any measures in place at those borders, for example, whether that is checking temperature and so on, to try and get a handle on this and stop further spread?
One would expect that because these countries are very connected. East Africa is a very interconnected region. Every country can get to the other on a bus. It's really hard to tell how these countries are responding to this because all these countries are now facing a health crisis in the midst of budget cuts because of USAID cutting funding. But WHO yesterday said that it had dispatched a good team of health experts in those regions to try and contain this virus. WHO specifically dispatched health workers with around $500,000 worth of funding, emergency funding, to respond to this. It's hard to tell, but all these countries, again, are very interconnected. One would expect that there should be measures to curb the spread of this virus, maybe temperature checks, which are routine in these borders at a time like this. But I highly suspect that these countries are trying to now spring into action to make sure that screening is effective against the virus.
The BBC's Thomas Mukwana, very good to talk to you. Thank you. Well, Professor Raina McIntyre is the head of Biosecurity Programme at the University of New South Wales, and she spoke to me earlier.
DRC had a very big outbreak, as you've mentioned, in 2018, and that was a Zaire strain of Ebola. This outbreak is a different strain, and it's not as severe as the Zaire strain, but so far there seems to be about a 30% death rate, which is still incredibly high. It also means that there's no drug or vaccine for this particular Ebola strain, which, for the Zaire strain, we do have a vaccine and experimental vaccine and drugs. So I think all of that, and the outbreak kind of came out of the blue. We suddenly heard about it on Friday, and all of a sudden there were 246 suspected cases. It really came out of the blue. So it seems to have been identified quite late. only 8 confirmed cases to date, and I think that just reflects the low diagnostic capability. But very worryingly, we've seen spread to Uganda and to Kampala, and also to Kinshasa, which is at the other end of DRC. So, and then there's South Sudan, also close to the border of this part of DRC. So there is a concern about spread to neighbouring countries, but also internationally through travel. Hopefully, though, it won't get big enough for that to be a major issue. In 2014, with the unprecedented West African Ebola outbreak, we did see travel-related cases occur all over the world, but that was enormous. There were, about 28,000 cases
Indeed.
altogether 12 years ago.